Hi, I'm Dr. Nancy McLaren, one of the physicians at the Teen and Young Adult Health Center, which is a clinic that sees patients from ages 9 to 26.
And I'm Julia Taylor. I'm also a physician at the Teen and Young Adult Health Center at the University of Virginia. And we have a couple of questions here that we wanted to answer about getting sort of your well child and preventative care. And one of the questions that was asked by students was, at what age do I have to stop seeing my pediatrician? And we wanted to tackle this question together because that is a really big question and it really depends on the practice that you're seeing. And so, as Dr. McLaren mentioned, at our clinic we see patients from the age of 9 to 26. So we actually see adolescents and young adults. But that's not true for every provider.
Right. And it really, as Dr. Taylor was saying, does depend on the provider and what their practice is. Some providers will go up to 18, some will go to 21. There's no real set guideline. Some will go even past 21. Some of them might say, I'll see you until you're done with college. Others might say, when you're ready to go to college, that's the time to end. And so you really just need to ask them. Some people don't see pediatricians, they see family practitioners, and family practitioners will see you from age 0 up to 99. So it really, again, is important to find out from the provider what the practice is.
So the short answer is at some point you probably do need to stop seeing your pediatrician, but that's really going to depend on your relationship with your doctor and what their clinic practices are. If you're seeing a family practice doctor, you don't ever have to stop seeing them. Hope that answers that question.
Sometimes the other thing that happens, and I know this happened with my children, is when they get to a certain age, they may decide that they want to see somebody different, especially as they're coming up and having discussions about topics that may be more sensitive, and so they feel like maybe they want to change, or maybe they feel they want to change how the practice is set up or how the rooms are set up, things like that. So you do also want to think about what works best for you and where you'd be more comfortable talking about some of these questions and issues that come up in a well-child check. One of the questions that students asked us, which I thought was a really great question, was about herd immunity and what is it, and then how does it affect people. This is a really important question right now, given that we're seeing an outbreak of measles across the country, when in 2000 measles was eradicated. One of the ways you're able to eradicate an illness is actually by vaccinating people against the virus or the bacteria that is the cause of the illness. And if you vaccinate enough people within a population, say if you have 100 people and you vaccinate 95 or 97 of them, then those people will actually protect against other people that you can't vaccinate, such as sick people or young babies or older people or people with immune problems if they're on cancer treatment. And if someone were to come into the community with the illness, such as bringing measles in, most of the measles cases in this country have come from overseas. If they bring that in, and by having herd immunity with people protected against getting the infection, it really helps put a barrier up then for the people that can't get the vaccine, and so protects them from also getting the infection. So you're really not only protecting yourself when you get a vaccine, but you're also protecting your family, your friends, your people on your sports team or in your music program, people at school, grandparents, and little babies, young children. So it's really an important concept for that. People often ask, well, if people are all protected and have herd immunity, then why do I need to get vaccinated? That's an important question in the sense that you have to have a certain percentage of the population in the community vaccinated, and it depends on the disease in order to prevent the disease spread. So if it's a really infectious disease like measles, it really does take about 97% of the population to be vaccinated in order to prevent the spread of the disease. And what's happened with these measles outbreaks is actually the vaccine rates have gone down because people aren't getting the vaccination, and that's why we're seeing the outbreaks.
And one of the questions that we got from teenagers about their well child checks is, can I really tell my doctor everything at a physical? Is it truly confidential? think this is a really important question, and I think there's a couple of key concepts that help frame the response to that question. I think it's important to understand the leading causes of morbidity and mortality for teenagers are things related to substance use, interpersonal violence, suicide, and unsafe sexual practices. And so knowing that those are the things that we really need to be concerned about with teenagers, what we know is that teenagers need a safe space to talk about those types of things, and that teenagers are much more likely to talk about those things if they're guaranteed that that information is confidential between them and their physician. Now, state laws and national laws vary based on your location, and so it's important to talk to your provider about their practices and what the laws are in your particular state. I think it's also important to know that nothing that we do in the office is meant to deter open lines of communication between you and your parent. We also know that teenagers thrive when they have open lines of communication about those very topics: mental health, substance abuse, and violence with their parents. And so when we talk about confidentiality, usually your provider will talk with you and your parent first. Some practices will typically have a form that they give to parents to inform them about their confidentiality practices. If you haven't gotten that from your provider, you should ask about it. And then usually we talk about the flow of information. So there's some information that you would give to me that we could talk about and decide who else gets it. I think it's important to know about the limits of confidentiality as well. So some of the things that you might tell your physician in a room, confidential and confidence, would be things that might be too big or too scary or too harmful for us to keep confidential. So if you let me know about things like someone's hurting you, that would be something that we would have to talk about with your parents and potentially with authorities. If you've had something like any type of abuse, that also might be something that we would have to talk to outside of the doctor's visit. And so those types of things might not be able to be kept confidential. Those types of things might not be able to be kept confidential. Also, some things that we might think about are the ways that confidentiality can be impaired by certain things like insurance or explanation of benefits and your medical records or your health information. And again, the way that it's handled differs based on state and your insurance, so it's probably best to talk to your individual provider about their practices. If you're really worried about something, we'll always encourage you to have a way to talk to your parents about it, but in most cases we can keep a lot of things confidential. But it really is a determination based on you and your physician about what's in your best interest to keep confidential.
A lot of these questions came out of questions that we asked different high school students in the area to come up with and things that were important to them. We're doing this as part of a global Teen Health Week, trying to focus on teen health all over the world and what are some of the issues and concerns that teens have.